Good morning, all. Let's learn about causes of hiccups now. Causes can be local causes, metabolic causes, and central causes. Most common cause of hiccups are local causes only, like gastric distension, inflammation, esophageal reflux, achalasia cardia, pericarditis, pleural effusion, mediastinal diseases, having undergone chest and upper abdominal surgeries, diaphragmatic irritation, subphrenic abscess. Metabolic causes are giving anesthesia, uremia, rise in blood urea levels, Addison's disease, hypocalcemia, and central causes affecting brainstem like medullary infarction, medullary tumor, multiple sclerosis, viral encephalitis including HIV, meningitis. These are the main causes of hiccups. Among all these, gastric distension, inflammation are first things to be ruled out. Thank you.